This is part 3 of the role transition lecture, and we start off with roles and competencies of the registered nurse, which the 3 roles: provider of care, manager of care, member of the discipline, and then your 8 core competencies of the graduate entry-level registered nurse. And this is from the National League for Nursing. So, professional responsibilities. Let's talk about being accountable. Accountability means that we are responsible professionally and legally for the type and quality of nursing care provided. Now, all of us have provided and will provide care and comfort for patients in all healthcare settings. The concern for meeting the needs of the patient remain the same, no matter where you work. This is regarding health promotion, disease prevention, dealing with disease and symptom management. The nurse in every setting needs to know what they're doing. They need to be competent. And the nursing profession regulates us through audits and standards of practice, making sure that we are held accountable for our nursing practice. So we have our ANA standards of nursing practice, which involve standard 11, leadership. So we see the competencies as the registered nurse. I'm not going to read through all of these. We've talked about several, and we'll talk about some more. But contributed to the evolution of the profession through participation in professional organizations was definitely beneficial to the profession, and everyone should get involved in some way, even becoming a member and just following what the organization is doing as to being a participant active in the organization. And also getting involved in politics, politics related to healthcare, related to nursing practice. They want quality of care, but there's also safety, nurse to patient ratios. There's a lot of issues in politics to get involved in. And the professional role of the RN as the leader. So at some point, when everyone becomes a registered nurse, you may be put in charge, which of course is a leadership position. We know that not everyone who's in a leadership position is a good leader or knows how to run the show. But, as nurses, we all have to be, an inspiration, a director of action with our patients. It's the behavior that defines the role. There's the skills needed for a good leader, and then some qualifications of a not so great leader, someone who's, resist new ideas, resist change. Um, they don't collaborate. They, allow things to slide by, like mediocre performance. They don't discipline, or they've got poor judgment. They don't have any enthusiasm. So at some point, when everyone becomes a charge nurse on their unit or in their department, make sure you follow the skills needed. Let's talk about being a patient advocate and why it's so important. A patient almost always experiences a decrease in independence, a loss of freedom, interference with their ability to make a decision. So it's our job to provide facts, to give them the options, but just make sure we don't try to sway them in one way or another. Just help them understand and know what their choices are. And also being an advocate in making a stand for your patient, reporting things to the provider when, things need to be reported. Being a counselor, we can use our therapeutic communication skills to listen, but we also need to know when, counseling is out of our scope of practice. Talking about being abused, well, then we need to make a referral to social services. Get someone involved that's got the experience and ability to intervene. Preceptor and mentor. Some of you may already fill this role in your position. If you've been an LPN for any length of time, you've been at your job for a period of time, you provide instruction based on experience. So as a preceptor, you're modeling behavior for that maybe new graduate nurse or new nurse to that facility or department. And it's their job to observe you. Observe what you're doing, watching your interactions with patients, problem solving, using the nursing process. So as an experienced registered nurse, you might be asked to precept a nursing student or even a new graduate. And being a preceptor or mentor, that can be a really rewarding experience. I know that I had opportunities to do that over the years, and once you see that person out on their own, being successful, it just makes you feel good.